Menopause is when periods stop due to lower hormone levels, usually affecting women between the ages of 45 and 54 years old. However, menopause can happen earlier in life. Affecting anyone who has period, menopause can happen naturally or be triggered by surgery to remove the ovaries, oophorectomy, or the uterus, hysterectomy. Menopause can also occur earlier due to a genetic condition, with reasons sometimes unknown. Unfortunately, menopause continues to be a taboo subject in some circumstances, despite women across Scotland, the UK and the rest of the world facing physical and mental challenges as they go through the change. October is Menopause Awareness Month, which raises awareness and tackle the stigma surrounding the experience faced by women across the world. Recent research carried out by ASDA Online Doctor highlighted the challenges faced by women when it comes to reaching out to access care and support during menopause or their perimenopausal years. Collecting data from 2,000 UK adults, the study found that 1 in 7 women on average reported difficulties receiving care and support during the transitional period. The research indicates that many encounter obstacles, with their mental and physical health impacted as a result. The study found that 15% of women saw their mental health impacted by menopause in the last 12 months, increasing to 29% for women aged between 45 and 54 years old. Previous studies have shown that public awareness of menopause and misinformation significantly impacts on the ability of women to advocate for themselves. The ASDA Doctor research found that 13% or women find it tough to talk about menopause with their healthcare provider, suggesting that these women face delays in treatment. This delay may be in part due to the stigma and reluctance among patients to come forward, the research suggests. It is important to know the symptoms and know your body, reaching out for help, treatment and support if needed. What are the symptoms of menopause? According to the NHS, common symptoms of menopause include hot flushes, night sweats, vaginal dryness and discomfort during sex, difficulty sleeping, low mood or anxiety, reduced sex drive, libido, problems with memory and concentration. Most women will experience menopausal symptoms, but the severity of these symptoms can differ. Some symptoms can have a significant impact on day-to-day life, while others are less severe and can be managed quite easily. Symptoms can begin months or even years before your period stops, lasting around years after your last period. However, some women experience some of the symptoms listed above for much longer. Perimenopause is when symptoms begin before your period stops. When to seek advice or medical attention for menopause symptoms, it is important to reach out for treatment and support if menopause symptoms are impacting your life. Your GP, a nurse or pharmacist can give you advice to help manage menopause and perimenopause symptoms. Additionally, you can speak to a menopause specialist, experienced in supporting anyone going through perimenopause and menopause. You can find your nearest NHS or private menopause specialist on the British Menopause Society website. Therapy and counselling as well as CBT, cognitive behavioural therapy, can also be a huge help. Your GP may be able to give you advice and point you in the right direction if this treatment method is suited to you. However, you may be able to get NHS talking therapies without seeing a GP first. There is more information on the NHS Inform website here. What treatments are available for menopause? The main medicine prescribed to help treat menopausal and perimenopausal symptoms is hormone replacement therapy, HRT. This medication works by replacing the hormones at low levels in order to tackle symptoms. HRT involves using estrogen to replace your body's levels during menopause. There are different types of HRT, with different doses prescribed based on symptoms and severity. Both estrogen and progesterone can be prescribed in different forms, such as skin patches or tablets. However, many choose not to or are unable to take HRT due to medical condition or family medical history. There are other treatments available if this applies to you. You should speak to your GP about possible treatment as well as other options that may be available and best suited to you. Dr. Crystal Willey, a leading physician at ESDA Online Doctor, said, "Public awareness, stigma, long waiting times and a failure among healthcare providers to identify the symptoms of perimenopause have all been shown to frustrate women's ability to access treatment. It is crucial that policymakers and healthcare professionals provide the public with more information about menopause, and are given the necessary resources and training to accurately diagnose it, so we can improve access to treatment and make sure patients receive the care they need during this important life stage." Some of the most common symptoms of menopause include reduced libido, sex drive, hot flushes, vaginal dryness, night sweats, low mood, anxiety, trouble sleeping, problems with concentration or memory and weight gain. A menopause test may be useful if you are 40 to 45 years old and have menopausal symptoms. Don't miss the latest news from around Scotland and beyond. Sign up to our daily